and Israel has launched what it terms targeted ground activities, with troops expanding operations in central and southern Gaza. One day after bombing resumed, the truce is over. Families that had begun to return to their homes now facing the very real possibility they'll have to flee once again.
We woke up to the sound of explosions at 2 a.m. Some people were killed and some ran away. At least 10 people were killed in our neighbour's house, and there was smoke and shrapnel everywhere. We just kept running. We have no idea where we should go.
2 months after it began, the ceasefire has crumbled. Israel today sending troops into Gaza after an aerial bombardment of the Strip.
The airstrike came suddenly. We thought our home was hit, but it turned out that the target was the school next door.
My uncle and his daughters, my sister and her children, and my brother are all buried under the rubble.
Talks over the second phase of the truce had broken down last week, the US and Israel pushing for a renegotiation that would see more hostages freed, Hamas insisting all parties stick to the terms of the original agreement.
In the past 2 weeks, Israel did not initiate any military action in the hope that Hamas would change course. Well, that didn't happen. And this is why I authorized yesterday the renewal of military action against Hamas.
That military action resulting in the deaths of more than 400 people as airstrikes hit shelters where families slept.
Many of them are women and children. This has to be stopped immediately.
Gazan hospitals overwhelmed with the injured, rows of the dead lining the courtyard. A UN staffer was killed and 5 others severely injured when a strike hit a UN building in Gaza. One official claiming the army knew what the facility was.
In my opinion, this was not an accident. It cannot be categorized as an accident. I'm shocked and devastated by this tragic news.
Fury spilling into the streets of Jerusalem. Israeli protesters claiming the hostilities will further endanger hostages. But Netanyahu has promised these strikes are just the beginning.
I call on the people of Gaza, get out of harm's way, move to safer areas.
I'm an ordinary person. I just want to live a normal life like everyone else. We don't expect for more, not even bread, food or water. All we want is to live in peace.
Dr Wajid Khan is an ICU specialist from Sydney. He's currently in northern Gaza at the Baptist Hospital there. Dr Khan, we've seen vision of hospitals overwhelmed with patients. What's it been like for you working there on the ground in Gaza?
It's been quite horrific because we're not able to provide really any sort of care to the patients who are coming. The Gaza health system's already pretty much collapsed, and so whenever we have an event like the mass casualty event we had two days ago, we simply can't just manage any other cases. So we're finding that the patients that come, very selective patients we're able to treat, but unfortunately, most of the patients are dying because we don't have the medications. Our equipment it's not working anymore, or it's been damaged. And also, we don't have enough medical staff to manage the cases that we are currently seeing.
What's the situation there with just pain medication?
It's almost non-existent. So just to give you an example, when we put, if patients can't breathe, a routine procedure we do is intubation, where we put a breathing tube across the vocal cords into patient's lung. We usually have a sedative medication, pain relief medication, and a muscle relaxant to make it easier. We didn't have any of those procedures, any of those medications. And so just to sort of portray that, I had to sort of put that breathing tube in someone who's awake, and he was screaming and coughing up blood into my face as I was doing this life-saving procedure. So people who are dying, unfortunately, we cannot provide, dignity and comfort care because that medication is very minimal and we have to ration it.
So what do you say to people when you just don't have the medication on hand to save their lives?
This is a very difficult conversation because I've actually never had that conversation before, sort of coming to Gaza. Everyone here's had sort of some family member who has lost. All the people that I've seen have been critically unwell, so I've had to have that conversation with their family. And it's the most horrific experience being not able to treat patients with comfort and dignity, even if they're not going to make it, because we don't even have that medication.
And what's it like working under these types of conditions?
It's almost impossible. You know that you're doing the best you can with the limited of resources. It's just because we've had no influx of sort of medications, and even in the ICU, we haven't even got enough food or water to sort of feed our ICU patients at this point in time. So the situation we're currently in, if you're not going to sort of die by the bombs, you're almost going to die in hospital because we've got very limited supply.
Dr Khan, it is heartbreaking to hear what you're saying, and I shake as I ask you this question, but how are your staff and your colleagues coping with this?
I have to say the local colleagues who have been in Gaza since the beginning are amazing. They're very resilient, and I think a lot of us have kind of not sort of processed what's happening because we're just sort of trying to get the job done as it comes. But I'd have to say that I have not met sort of the local doctors and nurses and all the staff here on how resilient they are, how helpful they are. It's just amazing to see.
What makes a doctor leave the comfort of Sydney to run towards the danger to help people on the other side of the world? What pushed you over there?
I think looking at the situation and how we've all felt quite helpless, even though we've got limited supplies, I think being here, trying to support the local staff, it's all I can actually really do. And so that was the main thing that sort of led me to come to Gaza, because I think we need to all try in our capacity to try to do what we can. And this is something that I can do.
Are you aware of just how precarious your own safety is by doing what you're doing right now?
Yes, and my family are also quite worried and concerned. And the first bombing that happened was very close to our hospital. And the whole way through, I knew this was going to be very precarious and very risky. But I think at the end of the day, we all got to do, what we can to sort of, help the civilian population here, because it's so much more horrific than the actual reports that are coming out.
Dr Khan, such a privilege to speak to you tonight. Thank you for your time.
Thank you for having me.